or when are schools going to reopen? My second question is, how are boarders going to social distance while in the fields and dormitories? How are day scholars going to social distance while they are boarding the bus?
Right, so concerns there about school, and also another parent did send in a video asking whether the government really is prepared or not. Rudy, I'll direct that question to you. The child is asking when schools are going to reopen. That is, of course, the big question. But really, how are schools going to manage social distancing and safety and hygiene measures? What are the directives from the World Health Organization that schools and governments need to take into consideration?
So from the WHO, there are some very clear directives that it's only once the peak of cases have actually passed that one should consider the reopening of schools, or indeed the reopening of social interactions. And even then, it's very appropriate to maintain things like the hand washing practices, the coughing and sneezing etiquette, and the social distancing. So even in schools where possible, I mean, it's not always possible, where possible you would want the distance between pupils actually to be far apart, 6 feet apart. So that is really what is required. And in Kenya, we're still some ways off from that. So we're still at the moment in the increasing phase. So it might still take quite a number of weeks or indeed months for that to happen. So at the moment, we would not advise for schools to come back.
Okay, a question for you, Joan, from an absentee parent. Let's play that clip from an absentee parent coming up in just a moment.
I'm an absentee parent. How can I ensure that my children, while they are at home, they are safe from COVID-19?
Right, so a concern there, Joan, from a parent who's not always at home in the house with their child. He's absent. Maybe he's got a job that keeps him away. His worry is, how can he ensure his kids are safe?
The only thing that the parent can do is to give factual, appropriate information and ensure that the children are understanding this information, and sit down together and agree with these children how things need to be done, sort of create a routine, and allow the children to be the ones leading the routine. So probably this parent can avail a few things that the children need to keep themselves busy. And that way they will have kept or protected the children from being all over the place. That is one thing. Then occasionally the parent can engage children, especially in video calls, so that then they are again getting to be part of their life even while away. Not so much so to check and know where are you guys, but so much to follow up and be part of their process while they're away and the parent is at work. If the parent allows the children to be as honest as they can, then it improves chances of the children being able to keep to schedule and benefiting from that schedule that they create by themselves.
Okay. All right. Now, a question about quarantining and isolating children. Rudy, I'll direct this one to you. Let's listen in.
How can you quarantine a child who has coronavirus and is about 2 months or less older? How can you keep him away from his parents?
All right, so that young man asking, how can you quarantine a child who has a virus, who has the virus, and if the child is, say, 2 months old, how do you keep that child away from their parents? And also, he had earlier asked, how can you protect a child if the mother is breastfeeding? Can it be passed on?
So clearly you can't remove a child of that age from their parents. So the government has actually made provisions for that kind of situation, and they've made different types of quarantine where infants like this actually would go with their parent, with their mother, and also to take care of the breastfeeding question. It's not established yet if breastfeeding itself can transmit the virus or not, but just the close contact with the mother itself, of course, does pose some risk. But there's no question that quarantine cannot, for an infant, take place without a parent being present. We would never support that. So government is in fact taking care of that.
All right, and two more questions, one about pets and one about plants and fruit and vegetables. Let's listen to those.
Can our pet get coronavirus?
Can coronavirus stay on plants and vegetables that you consume?
Rudy, that's for you again. Can a pet get a coronavirus? The young girl's asking as she holds on to her dog. And also, can the virus stay on plants and vegetables that we consume? Rudy, can you hear me?
Yes. So we do have some information about some pets having been tested positive for coronavirus, but there's absolutely no evidence that they can actually transmit the virus. So as far as we know from the WHO, from the experience so far, pets do not transmit this virus. It's really from people to people that this virus gets transmitted. The question about vegetables and food we eat, the virus is transmitted by little droplets that are caused by sneezing or coughing or speaking loudly. And those droplets can, of course, settle on food that we prepare. So it's absolutely critical that the food that we prepare is really handled in a hygienic manner, is peeled or washed and then cooked properly. If that is the case, if the fruits and vegetables are cooked, are peeled and are washed, there's absolutely no risk. The virus is actually quite sensitive to things like washing and soap.
All right, thanks very much, Rudy. Joan, are you able to hear me? All right, it seems that unfortunately we've lost the connection there with Joan, and at this point we do have to wind up this conversation. Rudy, I'll just come to you for your parting remarks on really some words of hope and confidence to parents who are worried about their children's future. This is the beginning of a different kind of life for this generation. Did you get that question, Rudy?
No, I did not. Please repeat.
All right, just as your parting shot, there are parents who are anxious and concerned about the future of their children with the existence of the coronavirus. What are your words of wisdom and hope to those parents who are concerned about the future?
Well, this is a virus that we don't know very well, but the fact of the matter is that there are 7 coronaviruses that affect human beings. And many of these coronaviruses actually don't cause much problems. The 3 coronaviruses that have caused problems, the SARS virus, the MERS virus, and now this COVID virus, actually with time get under control. So I think the future is such that probably we'll have to defend ourselves against this virus for quite a time. We'll have to probably continue to do these things that we've been teaching our children at the moment. But I think ultimately with vaccines and with treatments, we'll be able to overcome this virus, and actually get back to a life that resembles something like it was before.
All right.